Issued a fresh warning tonight that coronavirus will overwhelm the NHS. It comes as we follow official guidance to stay at home to save lives. Crisis is changing life unless as we know everyone starts to practice social distancing.
The coronavirus is a respiratory disease that can potentially be fatal. About 1 in 6 people become seriously ill. The elderly and people with underlying medical problems are at a greater risk of serious illness from COVID-19. More than 340,000 cases have now been confirmed since the outbreak started, and the death toll has exceeded 14,700. The majority of cases are now outside China, and the virus has spread to more than 100 other countries. Businesses up and down the city have been given no choice but to close. We spoke to Antonio, the co-founder of Gelato Village, an independent dessert parlour based in the heart of Leicester.
For any other business in the catering industry, we've been affected because clearly there's no customers around, which is fair. I have to say we were a bit worried, but then finally the announcement from the government to shut every restaurant, pubs and eateries has made it easier to take the decision to shut down completely. We got to think of the customers because we can have a number of customers inside and also our staff. So I think we are all affected in the same way. Of course, it's spring just started, it's a sunny day and we would be, very, very busy, but there's nothing we can do.
As well as businesses being affected, schools have been forced to shut, leaving parents and carers in a difficult position. We spoke to Mariam Khan, a pharmacist based in Leicester whose home and work life has been directly affected by the coronavirus. Here's her story.
It's been a bit difficult. I think we're in the same boat as everybody else. I got a bit poorly a couple of weeks ago, so I had to stay in. I've been off work for 2 weeks myself. It's been hard to self-isolate, and that's where it's a big problem with a lot of the population that have to do that. So it's been tough. There's been a lot of changes going on at work, which I've not unfortunately been involved with at the moment, but going back to something different. We've heard yesterday that I work in private healthcare, so they'll now be part of the NHS workforce, helping them, and we've got obviously new changes coming, new ways of working. So there's a lot of change going on, a lot of unsettlement. So people are obviously naturally worried. We are as well. Obviously children, the schools have closed, so we've got the children home. Well, I've had them home for 2 days, and yes, by the day 2 it was very challenging, as you can imagine. So that's been a bit tough, and debate of whether to send them school or not while we work, because I'm classed as a key worker, and so is my husband as well. So it's really hard for us to decide how we deal with the schooling, how we go forward. I obviously work in the hospital, so naturally we're worried. I am as well, exposure to patients. We don't know how to behave or handle or do things, and we have a duty of care to the patients as well that are coming in through the hospital doors. So there's a lot of unrest, a lot of things going on, and it's going to be a difficult few months, I think, while these changes come through.
We caught up with an organisation called Leicester Community Response, a partnership of community and voluntary organisations that have come together with the sole purpose of establishing a bank of volunteers who can be utilised to support local service provision for the elderly and vulnerable in Leicester during the COVID-19 emergency.
Leicester Community Response is a collective of organisations. So basically what happened due to this coronavirus, we thought we need to do something, and obviously there were many people sending messages to say, we want to do something, what shall we do, what can we do, and there were other individual organisations. So rather than everyone doing their own thing, we thought it'd be a good idea if we came together collectively and just to see what we can do collectively as well. So on Monday we had a meeting. We called, actually it was on Tuesday, we called all the local groups that had contacted us, and we got in touch with them, the mosques, and over 30 groups and mosques and individual organisations had turned up. And again, we spoke to them in terms of what can we do collectively, and also that, you know, rather than everyone doing their own thing and people getting confused and duplicating, we will be stronger together. We had a meeting, a lot of people gave their opinions, a lot of diverse opinions, but everyone worked together in terms of, yes, let's work collectively, let's do something together. So what we've done is we set up a website, and we've basically collected a database of all the organisations, and then we've gone back to the organisations to say, how many volunteers can you get? And these volunteers will now be available for the Leicester City Council or Public Health England, whoever needs us, the police, if they needed support, if they needed help, then we have these individuals who are going to be ready to go out there and support and help. So that's what's happening so far.
We are the Visual Collective, an independent non-profit organisation for innovation at the intersection of data, technology and design, with the sole aim to raise awareness of issues both relative in the first and third world. Join us on our journey as we highlight a factual rights-based narrative, inspiring change through digital design.
Yeah.